Khamsiriwatchara, who's actually going to be presenting from Mahidol University from the Center of Tropical Medicine. And he's going to be talking to us about Better Border Health Program, which is handling rural health care on the border of Thailand.
Thank you. My presentation is about using mobile phone to improve how to track the antenatal care and mother-child. Even though the structure of the healthcare in Thailand is good, well enough, but in some remote areas it's difficult to transfer the data because lack of low resource setting. This challenge will be improve the maternal health care, focusing on antenatal care, and reduce child mortality, focusing on expanded program on immunization. And the other thing is to monitor disease incident and treatment outcome, focusing on malaria. We got a funding from Microsoft Research. There are two models that we focus on. The first will be the mother and child and disease treatment. Here's the location. It's near the Myanmar border, along Thai-Myanmar border, under Thailand Ministry of Public Health structures. The mother-child care models, here's the model. Actually, at first, at the local health center, there's nothing to follow up of the case, so they have only the health center information system. When they put on the key in the data, they will print out the follow-up schedule, and without anything, they have just a paper base to follow up. And then we add our web server by putting the GPRS network and try not to increase their workload, just have them push one button and then extract those data from the health center information system and then transfer those schedules into our web server, and then we generate the SMS for reminder of the follow-up of each particular mother and child vaccination or follow-up of their maternity. So it's an add-on function of the, so it's not increasing the workload of their currently, so they just put on one button and then the system will generate a listing of the visit schedule, and it allows healthcare personnel over there to checking their status and it can capture the household location when performing the home visit. So here's the schedule that we generate from that. When you select the date, it will come out of the list. If they have the mobile phone, it will send the SMS. So the user over there sees that this system is very useful for their follow-up. So when they receive the SMS, they will come up to the health center and then follow up their schedule. The system is capable of following in case of the volunteer doesn't have any mobile phone to receive the SMS. There will be a volunteer health worker that can upload the schedule and then follow up and then go to each particular volunteer and then upload the status of each particular case visit. So here is the cluster that we can capture the location of the cases. As you can see, the mobile signal is within the only health center area, but we can capture data along this is near the Myanmar border, so there is no GPRS network, but we can use the GIS data to capture from the satellite, so it proves that even though the area is lack of mobile signal, we can still capture the data from that particular area. So the well-integrated system should not increase the workload of the local health center, but should apply to the existing tool. So we think that the mobile phone is the right tools to integrate into this kind of data collection. And another module is the disease treatment and monitoring model. We use this for our malaria surveillance system. So it can capture the subject profile, So this is the case. When the patient come into the health center, they will get diagnosis by microscopic test or whatever. And if they are infected case, they will be entered into the data into our web server. And it will generate the follow-up. If they are infected, they will be follow-up for 3 or 4 visits to ensure that the treatment has been done correctly. When we go tracking of the case, it will also map in the case for each particular visit and send the SMS on a weekly basis to summarize of the total case of that particular area. Here's the feature that we can capture the daily basis infected case, so we integrate this into the daily basis work of the local health center in the Myanmar, near the Myanmar border area. So the system can generate the infected case on a real-time basis. So this is each particular follow-up. It can map in the cases. That's the red line, the yellow line is the Myanmar border area. So we can track on each particular visit. So the module is proof that it can capture locations quite well, and it can tracking and modeling how local health staff and engage in their own areas. And now this system has been expanded. We are really glad that the system has been expanded from only one province into 7 provinces near the Cambodia border to capture the artemisinin-intolerant parasites. We believe right now this system has been in place in 7 provinces already, and next year I think we will share the knowledge with the Cambodia country to improve the surveillance system like this. Thank you.
Are there any questions for the speaker? I actually have one. I'm curious about some of the other things that we've heard raised over the last day were things about language barrier and the fact using SMS and whether or not that, if you encountered a problem using SMS, given different dialects in Thailand.
Actually, in Thailand, they have a few problems of the different dialects. But we have to think on that if we expand the system to the Cambodia country. So I think with the technology right now, I think they have different fonts that we can load. This is not depend on just only Thai language, so you can load the Cambodian language into the application.
Oh, directly. So it's not much of a problem.
No.
Okay, that's great. All right. Thank you very much. Our next speaker is Rachel Gormley. She's from the University of Pennsylvania.